we wanted to start by actually having Wendi explain to us what hemorrhoids are. Hemorrhoids is the type of thing that everybody knows the word, and a lot of people have seen hemorrhoids in movies, stand-up comedy, and TV, and it's usually a joke. But there's one thing that I know as a person that suffered from hemorrhoids for over 20 years, that there's not a lot that's all that funny about hemorrhoids. Carly's going to bring over a handy anatomical model that Wendi can use in order to explain visually.
Everybody has these blood vessels, but when somebody's speaking about a hemorrhoid is when these blood vessels that form either inside here or on the outside here, they form when there is some sort of pressure, and it's called a hemorrhoid when someone is actually feeling symptoms from it. So these blood vessels are always there. In some people, they become enlarged and then cause symptoms.
So we basically have sleeping hemorrhoids, which are basically swollen veins, and they're pretty similar to varicose vein in my leg, that when it swells up, it just swells near my butthole.
Exactly. So it's a varicose vein in the most inconvenient place.
Certainly inconvenient. I can't imagine another place that would be worse to have this type of swollen vein.
So it depends. So there are two types of hemorrhoids. Internal hemorrhoids, which form above this anatomical line called the dentate line. The importance of internal hemorrhoids is there are no veins that innervate that area. So most people don't feel internal hemorrhoids, but they experience them because internal hemorrhoids can bleed. So if you have hemorrhoids that bleed, those are internal hemorrhoids. External hemorrhoids, they're below the dentate line, and that's where all your nerve fibers that you normally feel around your butt, your anus, exist. And those are the hemorrhoids that you feel that are itching, burning, sometimes painful.
Do the internal hemorrhoids bleed because I wiped too hard and I popped it? Or is it just being scraped?
It can be either. So it can be scraping, usually from pressure when somebody's having a hard bowel movement. So that's the most common time when an internal hemorrhoid bleeds, is when they're pushing out basically a hard stool. But sometimes wiping aggressively, especially too far inside, that can cause an internal hemorrhoid to bleed.
Do people actually wipe inside their anus?
People do all sorts of wiping. There's, the very gentle wipers, especially if you have a hemorrhoid that can cause irritation. Less is more. But there are people who are aggressive wipers because they want to feel clean, and
they wipe to clean.
They like to feel 100% clean, and so that can cause irritation by being a little too aggressive.
Do you recommend people wipe with dry toilet paper and then with a medicated wipe for the best wipe possible?
So without hemorrhoids, I recommend actually using a bidet to clean the area, using water, and then using toilet paper to blot the area. If you have hemorrhoids, do the same kind of cleaning fashion and then finish off with the medicated wipe.
So it's interesting, people naturally go to wiping with toilet paper, but you should actually be blotting
exactly
with toilet paper.
And not everybody has a bidet. Most public bathrooms don't have a bidet. So you do what you can, but...
Well, Carly brought our bidet with us here today because she brings it everywhere.
There are travel bidets.
There are travel bidets. All right. Well, maybe we see a future opportunity for norms as well.